Welcome to the Medical Marijuana and Wellness webinar series. Tonight's topic is going to be cancer, chemo, and medical marijuana. And we'll be starting the presentation in just a minute. I do want to thank everybody for joining us. This is a very, very important topic, and I know one that, especially if you or a loved one or someone you care about has cancer, this is a very touchy subject, and there's been a lot of controversy about whether medical marijuana really does help with cancer. And we're going to answer some of those questions tonight and hopefully give you some insight into it. What I'm going to do is I'm going to switch over to a presentation that we put together that hopefully can answer a number of questions, and it'll help us be able to dig down into this topic. I do want to mention before I do that, if you take a look down over here, you'll see a little bit of a Q&A button. What I'd like you to be able to do is be able to ask questions. Click that Q&A button, and we'll be able to see your questions. Not to mention any of the questions that you submitted prior to the webinar, we will in fact be reviewing, and you'll be able to see. So tonight's topic is brought to you by. Tonight's topic is again cancer, chemo, and medical marijuana. I do want to mention that we're going to be joined in a few minutes by Dr. Terel Newton. He's done a lot of research into cancer and medical cannabis. He has some direct insights into that. He's just getting out of his office right now and going to be joining us. I want to mention this is part of a webinar series. Next week, we'll be doing two webinars on Wednesday, one in the morning on Medical Marijuana 101 Basics and Terminology. That'll be done live. We'll be doing a seminar in the Villages here in Florida. And then that evening, I'll be doing one with Terel on neuropathy and medical cannabis. This series is designed to give you information. It's not to be professional medical advice. We naturally recommend anytime you need medical guidance, please see your doctor, both your medical marijuana doctor, as well as your medical doctor. They can help you with a lot of this. And I also do want to point out, you can see over here, when we finish this presentation, what we'll be doing is we'll be giving you a copy of the recording, be giving you a copy of the slides. Naturally, any sponsor discounts will be sent to you, speaker information, and any resources that are out there, we'll be able to answer those. So without further ado, what I'm going to do is I'm going to jump into the seminar and be able to answer a number of your questions. Now, we've been asked, and I've been asked over my career, a number of things. So tonight, what we're going to do is we're going to really answer these questions. We're going to answer what cancer is, because there's a lot of controversy as to what it is and what it isn't. We're going to talk about what symptoms cancer are related to cancer. In other words, how do you know you have it? How do you know it's there? And what can be done about it? We're going to talk about how your body normally fights cancer. We're going to talk about what research has been done showing that cancer can help with cancer. And then also we're going to show you where you can go to get more information and some help. So this is what we're going to be covering during the webinar tonight. And naturally, any questions you submitted ahead of time, we'll be answering that at the end of this particular webinar. Plus any questions you put in during the webinar, we'll be answering those as well. So let's talk about what cancer is. What's interesting about cancer is there's over 100 different types of cancers that affect human beings. Cancer is basically it's a group of diseases. It has to do with what they call abnormal cell growth. And we point that out because this abnormal cell growth invades your body and spreads throughout your whole body. Cancer cells take anywhere between 5 to 20 times more energy than a normal cell. That's why it eats the other cells, eats all the material in your body that your cells need to stay alive. And that's why it's a dangerous toxin inside your body. It really can hurt you. There's a couple of things that we know when you have a malignant tumor. We know that it grows and it divides. We know it continually sends out contradictory signals that it's there. In other words, it's trying to mask itself, and we'll show you why it masks itself in just a minute. It tries to mask itself to the other cells to try to keep itself in a state where it can't be hurt. It tries to avoid what we call death cells. We'll talk about those. It also has a limitless number of cell divisions. In other words, you've already heard of aggressive cancers. That's because they grow very quickly. And it promotes the destruction or the construction of what they call blood vessels, which really causes a bit of problems. Now, what are the symptoms that you can see if you have cancer? Well, we know that you can get fatigue, chills, pain, weight loss, night sweats, fever, bleeding, nausea, vomiting. There's a number of different things that come with cancer. Not all of those symptoms happen every time you have cancer, but you'll find that with cancer, some of those symptoms show up. And unfortunately, they're very, very uncomfortable, and something that makes it very uncomfortable for people to be able to use. Now, what happens with cancer? Well, it turns out that our body, as we grow, is constantly creating cells. And when it constantly creates cells, it also can create cancer cells. We've been creating those since cancerous type cells, meaning cancerous type cells are cells that take five times more energy than other cells, if not more. And your body does produce those since you're a child. But why do they not become a problem until they get out of control? Well, we have a healthy immune system. We actually have cells that actually eat or kill those cancer cells. Let me give you a video on this particular subject that shows you exactly what they do.
The green cell you see here is killer T cell of the immune system, which is attacking the cancerous red and blue cell. You can tell when the killer cell has recognized the cancer cell because the two dots move around and contact the target. The killer cell then spreads out over the cancerous cell. Passing the video through a filter makes the killer cell look yellow. It allows us to really see how it focuses on the cancer cell. These killer T cells are constantly hunting down dangerous cells throughout the body and destroying them.
So we know that if you have a healthy body, you have T cells that are hunting down and actually killing and eating a lot of the cancer cells that we find within our body. And that's something that's a normal process. It's a normal process that we go in life. And so what's interesting is that what cannabis does to fight cancer is that cannabis contains two cannabinoids, one called THC and one called CBD, cannabidiol and tetrahydrocannabidiol. Now, what's interesting about that is that both of these, when they work together, promote what they call apoptosis. And what apoptosis is the programming of cell death. In other words, when it actually goes in and it kills those cancer cells, and it's a normal process that goes on within your body. It also, what CBD and THC does, is it inhibits the proliferation of cancer cells. In other words, what it's doing is it's going in and it's actually stopping cancer cells from being created. It actually gets them while they're being created and stops them from being able to grow. And it slows the tumor growth quite a bit and also stops metastasis. There's actually videos on this. There's seminars on this. And there's been a lot of research done on this. I do have to tell you that there's a lady I'm going to give a lot of credit to. Her name is Dr. Cristina Sanchez, who's been in Spain for studying cancer and cannabis for 26 years. And she's actually documented a lot of this, and she created really the emphasis for a lot of people around the world to start the research into this particular category. Now, what's interesting is your body. How does your body know you have a cancerous cell and you don't have a cancerous cell? Well, you have something called ceramides, and ceramides are something that are inside your body. It's a signaling protein that you'll find, and if the ceramide is high, then cancer death is going to happen. Apoptosis is imminent. And that's something that your body normally creates and it finds. Now, it's interesting that if your body has cancer that's trying to mask itself, it's actually masking that signal. And that's something that's interesting because cannabis, as well as pharma drugs, really go out of their way to try to identify those cells that are trying to mask themselves. And it's something that we have to take a look at. And we have to make sure that it can, in fact, get to those cells that are trying to hide from the normal ceramide or the normal signals that are sent out by ceramide. If ceramide is low in a cell, then it means that cell is getting strong. It's vital. It means it's growing. And that's something we just don't want to have happen with cancer. Now, normal cells normal healthy cells do not produce ceramide in the presence of THC. Thus, it is not affected by cannabinoids. Very simply put, THC connects with the CB1 and the CB2 receptors in the cancer cell, and it causes that increase of ceramide, which creates cell death. So we know there's a process going on within the cells to have them, in fact, kill themselves internally. And I have to point out, this is much less invasive than things like chemotherapy or even radiation. This is a natural process that we're really promoting within your body to be able to stop and to be able to arrest cancer. Now, I will also point out, why do they use chemotherapy and radiation? Because if your body is starting to get out of control, these cells are growing at a rate, what you want to do is you want to stop them as fast as possible. The doctors want to stop them as fast as possible. You probably want to do the same thing. So by putting a combination of chemotherapy, radiation, and cannabis together, it really helps to be able to increase your chances of putting cancer in remission and being able to handle that. Now, how does all this happen? Well, if you take a look at the THC in cannabis activates the CB1 and the CB2 receptors. These are called lidocytes, and that really causes apoptosis, as I mentioned before. It induces the ceramides, and it leads to reduction of the mitochondrial function, meaning what you look over here with leukemia, it's addressing the CB1 and CB2 receptors, and it's actually going in and helping to really slow that process down, if not eliminate it itself. And glioblastoma, I'm having trouble pronouncing that one. You can see the same thing is really happening. It's going in and it's addressing all those different receptors, all those different processes within your body to be able to slow down, if not stop, the cancer that's in your body. Now, CBD also plays a very, very important role. What it's doing is it's reducing, it reduces the transcription and translation of what they call the ID1 gene. And what's interesting about that is it reduces both the mobilization and the proliferation of cancer within your body. And it also creates a process called angiogenesis. Angiogenesis is when it goes in and it actually goes in and starts reducing, if not stopping, the growth and being able to kill and again, create that apoptosis process where we're getting rid of the cancer cells that are out there. Now you can see over here, in the case of CBD, it actually helps a number of things besides leukemia and glioblastoma. You can see where it helps with colon cancer. Here's the receptor it works with here, the GPR55 receptor. It also works with cervical. Here's cervical and lung cancer. We know the receptors that it's going down, and we know that it's addressing. So we're at the cell level, at the actual receptor level. We know that this is where cannabis is interacting with your body to be able to put cancer, to reduce the efficacy of cancer in your body, to reduce it, to basically starve it, and causing cell death. And we know this has been researched. There's some research that's been done that's out there. And if you look at the research that's been done as far back as 2006. So we know that there's a lot of process that's out there. Why is it taking so long for this to come to light? Well, first of all, there are 100 different types of cancer, so it's not a matter of just studying one or two. We've mentioned 5 down here in the CBD category, but also there's a number of different cancers that we have to take a look at. And by having a Schedule I drug here in the United States, it's really stopped us from doing the research we need to do to look at what different cannabinoids, terpenes, and flavonoids work together to be able to stop the cannabis process. We need to do more research. That being said, there's a tremendous amount of research being done, as I mentioned, in Spain with Dr. Cristina Sanchez, being done in Israel, being done in England, being done in Germany. So outside of the United States, we find a lot of research being done, and this is where a lot of this information is really coming from. Now, what's interesting here is a study that was published in 2011. And this particular study indicates, it shows the cell death. Now, if you look at the graphics that are up here, now I'm going to download it, hopefully it's easier to see. If you see over here, this is a healthy cell. And you can see that once cancer enters the body, it creates that becomes like Swiss cheese that's in here. This is the cancer attacking that cell, eating the cell, and reducing it. What's interesting is with high concentration of CBD, what's interesting is, again, the process of being able to put that back into remission starts taking place. And these are the different processes that it goes through. You can see some pictures here where it in fact brings the cell back to being normal. In other words, what it's done is it's got rid of the hungry cancer cells, eliminated them, and allowed the normal cells to come back and grow and get the essential ingredients they need to be able to stay alive. And this was a study that was published in 2011, which I find very, very interesting. How does all of this happen? Well, it happens in a number of different ways. Dr. Newton, do you want to help me and do you want to comment on some of these?
Sure. Can you hear me?
I can hear you, sure.
Okay, great.
We're
Great.
talking about one of your favorite subjects, which is the entourage effect and the different terpenes, how they interpret and how they help with being able to address the cancer situation with people.
Oh yeah. Yeah. The entourage effect, that's a very powerful tool, when you're talking about the cannabis medicine. The way it was discovered was it was found that we have free fatty acids in our bodies that are components that make up cannabinoids in our body. And it was discovered that the cannabis in our body works better in the presence of free fatty acids, but those free fatty acids by themselves don't really act at the receptor. And so it was an interesting observation by a researcher named Raphael Mechoulam. He's actually considered the grandfather of cannabis research. And he discovered this synergistic effect. So you have cannabinoids that are present, but they can be other molecules around that makes the cannabis work better. And that's the entourage effect, but that's where it was first observed. However, the entourage effect also happens when other cannabinoids are around and when also terpenes are present. And so this is where you have cannabis is a very potent and amazing medicine because it has multiple cannabinoids, but then you also have these other molecules, aromatic compounds that are terpenes that can also give huge amounts of benefit to patients, especially when you're dealing with inflammation, pain, anxiety, insomnia. There's so many different conditions that the entourage effect, it just gives you a very potent results with a low dose of medicine.
Terel, it was interesting as we were preparing this, how you were finding out how the different, now cannabis is made up, we hear about cannabis strains, and cannabis strains each contain terpenes as well as flavonoids. And it was interesting how we were finding out about how different terpenes in the cannabis plant itself go out and address let's just say, have different aspects of controlling cannabis in your body. For example, you take a look at pinene and the research studies there. Tell us a little bit about those.
So with pinene, it's been shown in some concentrations to induce apoptosis, which is a programmed cell death.
I think we lost Terel for a second. But what we found out is when we're looking at this, we found out that go ahead, Terel.
Yeah, and it's one of those things that's is quite amazing is that in many cases, not only can the cannabis shrink tumors, but also so can terpenes. So there's a study with limonene that looked at patients that had breast cancer, and they did an MRI before the study. And then during the study, the patients either took 2 grams of limonene or they took placebo. And then at the end of the study, they had another MRI. And those patients that took the 2 grams of limonene had a shrinkage of their breast tumors before they were removed. And so if you combine cannabis and its ability to reduce blood supplies to cancer, to inhibit some of the cancer genes, to induce apoptosis, which is a cell death, and you combine that with terpenes, you can get an even better result. And then it's a great complement to chemotherapy and radiation. It can actually help it work better. There's multiple studies that have shown the synergistic benefits, but terpenes by themselves also have tremendous benefit. And this last one I found very interesting, this beta-alanine. That's actually a prescription medication in China. And that's what the white and blue box at the bottom there, that's a picture of the prescriptions that they have, which are they're available injectable and can be taken orally. But that beta-alanine, that's also in, I believe it's in celery. But when we think about letting our food be our medicine, this is one way we can let food be our medicine, is that we take the phytocannabinoids and different chemovars that has these different terpenes as well, but we can also supplement that with our diet also.
Sure. Now, I think it's also important to point out that these terpenes are typically found in the various strains. And we'll talk a little bit about that, how to find the right terpenes in the strain profiles. That will recommend some to you. But it's fascinating that you take a look at countries like China, they actually are packaging products you can buy that are terpenes to address the cancer situation, right?
Yeah, and that's available by prescription. They're in China for lung cancer, hepatic tumors, metastatic breast cancer, and leukemia.
Yeah, it's interesting. I'm just saying we need to really start taking a look at that here in the United States as to what we can do to start helping people with a lot of different situations that are there. So let's talk about cannabis as a whole plant. Terel, what's fascinating, I know as a medical doctor, you find that cannabis has a lot of medical properties. In fact, I don't know if there's any other plant that has as much medicinal value as cannabis. And cannabis is really a plant that acts as a medicine. It's not a drug, right?
Well, the versatility comes in where there's thousands.
I think what we're trying to point out here is that what we found out in the cannabis plant itself is there's over 450 medical properties in cannabis itself. Not to mention there's 120 different terpenes. 100 terpenes that we know about are being studied, and there's 120 cannabinoids that are being studied as well. It's very fascinating to me that this one plant has such incredible medicinal values. If you look over here, you'll see this is just only 6 of the cannabinoids that you find or in cannabis itself. THC, CBD, we know about them, CBN, CBDs, but there's over, again, 120 of them, and working together with the terpenes bring on what they call the entourage effect. And what does that mean? We'll actually show you that in just a minute, but it's the cannabinoids working together that actually help to be able to provide the healing efficacy of the cannabis plant itself. It's there.
And there's over 100 cannabinoids, and terpenes, there's hundreds of terpenes. And when you combine the different combinations of cannabinoids, terpenes, and there's even something called flavonoids that will come up to a little bit later, but those combinations in different concentrations and amounts makes the medicine the most versatile medicine that we've ever come across.
Sure. So let's talk about something I found very interesting. For years, when since I've been alive, we always heard about the nervous system, and I find the nervous system I call it the cell phone system of our bodies. What happens is if you bang your finger, you hurt something, it tells your brain, Houston, we have a problem. And that's something we've known about for a long time. But what was fascinating to me is that it was never studied by Western medicine. And it wasn't until we started studying cannabis that we identified what they call the endocannabinoid system, which works in concert with our nervous system. So when your body says, Houston, we have a problem, to your brain, what does your brain do? Well, your brain hands it over to the endocannabinoid system to manage that particular process, or that problem, I should say. It affects pain, it affects anxiety, memory, appetite, inflammation, immune system. Terel, tell us a little bit about the endocannabinoid system.
Yeah, so one reason why this wasn't discovered earlier is because, like you said, cannabis was prohibited in the United States. So we weren't really doing studies here. However, in Israel, they were doing studies on how cannabis works in our bodies. And one of the discoveries is the protein where the plant-based cannabis acts at, where it works on the cells of nerves. And the cannabis in our body works a very similar way. However, the cannabis in our body is made on demand, meaning that it's only made when we need it. So if we combine phytocannabinoids, which is the plant-based cannabinoids, and work for a longer period of time, we can supplement that and we can actually overcome endocannabinoid deficiencies. So if someone's cannabis is low in their body, which is seen in fibromyalgia, is seen in bowel disorders and migraines, we can overcome that deficiency by supplementing what the body needs with the phytocannabinoids, which are much longer acting.
Right. And that's really fascinating that, and this has been going on literally for centuries. And it was a very natural process. We're only kind of discovering it now and really starting to do research into it now. Is that correct?
Yeah, we're just now, when we search different studies, we're starting to see an exponential increase in research studies, in part because now we have almost 40 states that has it available for medical use. Mm-hmm. So we're starting every year, you'll see more and more studies on the endocannabinoid system, how it interacts and how it protects us against cancer, how it protects us against epilepsy, how it protects us against neurologic conditions. And with the research that has been done, we've actually funded some of the research that was done in Israel, and our National Institute of Health got a patent on cannabinoids to protect the brain from traumatic brain injuries, and this was in 1999. So this has been around for a long time. However, it's only more recently that we're starting to see more studies on it.
Well, it's fascinating that the United States government, through the National Institute of Health, has been funding research into medical cannabis since 1964. Let me say that again. Your money and my money has been funding research into medical cannabis since 1964, but because it was illegal here in the United States, we funded Raphael Mechoulam in Israel, who made tremendous breakthroughs over the last, literally over the last 50, 60 years, to really open our eyes to the healing properties of cannabis and offering us an alternative to for medicine that's out there. Now, if you take a look at what you're talking about here, everybody hears about cannabidiol and CBD and THC. Tell us the difference between them, Terel.
So CBD is a type of cannabinoid. It's extracted from the plant, but it is not intoxicating. So it can help us relax. It's a potent anti-inflammatory, but sometimes it's referred to as being non-psychoactive. The most specific term is it's not intoxicating. So you won't have a drunk, you won't have a high feeling with that. THC is much more potent. It's a potent pain reliever. It is a medicine that when combined with CBD, it can help CBD work even more efficaciously. So you can get better results in cancer. You can even get better results with pain, better results with spasms when you combine the two. However, with the THC, you want to slowly increase that because that can have some degree of side effects, dizziness. It can be a little bit intoxicating, problems with balance and things like that. So if someone is sensitive, they'll want to start very low and slowly increase. But they work very well together and they complement each other.
Well, here's an example. We talked about the entourage effect, where we're combining THC and CBD together. Now, there are, again, 120 different cannabinoids that they're studying. There's over 200 of them that have been found. Same thing with terpenes. We just took a sample set here, but here's an example of where CBD and THC work together. Here's the different areas in which you have CBD, CBD, CBC, THCA, working to inhibit cancer within the body. This is an example of the entourage effect, right?
So this is a slide that's showing a lot of results of preclinical studies. So when they look at cells in a lab, when they look at animal studies, these different cannabinoids have been shown to slow cancer growth, even induce apoptosis. We can't, say that it cures it. However, it's been shown that there's improvement, and it's a number of mechanisms of how that improvement occurs. But when you combine multiple cannabinoids, that's all helping by inhibiting cancer growth, that's where you get even better results. And this is why there's such a big push for whole plant medicine, because if you're just getting an isolated cannabinoid, you're just getting one medicine, one plant-based medicine for that particular disease process. But if you can combine 5 medicines for that disease process, you're more likely to get a positive response.
Right. And also, here's how it works with inflammation. You can see, again, a lot of times when you have cancer or you have injuries, inflammation comes into play. It also is the same thing for pain. Here's where they all work together, and also for sleep. You can see here where that whole entourage effect, where all the CBD and THC different families of the cannabinoids all work together to provide this interesting effect. I find this very interesting. In fact, it's only a sample set of the cannabinoids that are out there. Imagine if you took all 120 of them and you mapped this, it'd be very fascinating, wouldn't it?
Yes, and the good thing about the certification process and having your card is that for each product, there's a certificate of lab analysis where you can see the concentration of these various cannabinoids. So you can really pinpoint and really focus in your medicine by selecting the right product for you, because you have that certificate of lab analysis that tells you the concentration of each cannabinoid and each terpene.
Right, which is great. Now, this is an interesting slide about how much do you take. Terel, walk us through this, because really what you're looking for when you're using cannabis is what they call the optimal therapeutic dose. Explain that to us.
So in general with medicines, there's a concept of starting low and going slow. And the importance of that is that you want to gain benefit. However, you want to avoid side effects as well. So most positive results are dose dependent, meaning the higher the dosage, the more likely you are to get relief. However, there are some instances where if you continue to take a higher dose, you will get diminishing relief. And that's what's called a biphasic effect. So if we look here on this graph on the left side, we have predicted value of spontaneous pain. And then on, which is on the y-axis, on the x-axis at the bottom, we see THC dosage. And if we follow the blue line, as we go from left to right, you see a declining amount of spontaneous pain, and you get to that bottom part, the optimal therapeutic doses. And then once you get above the optimum therapeutic dose, you can start to see a loss of efficacy, basically a loss of benefit in pain relief. So this is the point about starting low and going slow, because you want to try to get to that optimum therapeutic dose without passing that to where you get declining benefit.
Right. There's a lot of people, there's a lot of perception that the more you take, the better it's going to be for you. But in certain cases, as you mentioned, cannabis is biphasic. If you take a little bit too much of it, you start climbing up this little trail up here, and it actually, it almost defeats the purpose of taking cannabis.
Yeah, and every patient is going to be different with regard to their optimal therapeutic dosage. So this is one thing that if you take CBD, in many cases, it can protect you from the side effects of THC. And so that helps you actually shift that curve. And so with CBD, it's going to block you from a lot of those side effects like feeling dizzy, problems with balance, but you will still get the benefit of the THC. Mm-hmm. So another strategy is to take high ratio products, meaning products that have 5 to 10 times more CBD than they do THC.
Mm-hmm. And when you hear about, when they talk about ratios, you hear about like 5 to 1, you hear about 10 to 1. But what does that mean? What's the first number mean? When you say 5, it means 5 what?
So for example, if you have a CBD THC product that is 5 to 1, that means for every 5 milligrams of CBD, there is 1 milligram of THC. Mm-hmm. So in other words, let's say in that product, you have 50 milligrams of CBD, then you will have 10 milligrams of THC. There's always 5 times as much CBD as there is THC.
Right. And what's fascinating is every person's body is different. We'll talk about this a little bit later, but just like alcohol and just like caffeine, every person's body reacts a little bit differently. It's hard to be able to say, take this. I think in Western medicine, it's take two pills and call me in the morning type of thing. Unfortunately, with cannabis, you've got to really find out how your body reacts to THC, how your body reacts to CBD to find that optimal therapeutic dose. And that's where you need to be able to try a little bit, try some 1-to-1, find out at what point you can feel the effects of THC, then increase the amount of CBD that you're using to see if that actually helps to address the relief that you're looking for by using the cannabis product. That's a pretty good strategy, isn't it, Terel?
And that's a strategy that can be used not only for pain, but for anxiety, for PTSD, for so many different symptoms. And that's what makes cannabis so unique, is that it can treat so many different symptoms related to a disease. And even deeper than that, it can treat the disease itself. So it's really amazing in the versatility.
Sure. Now you take a look at how cannabis works. Why don't you walk us through this a little bit?
So, one way that most medicines work is by interacting at the receptor. So, we talk about CB1, CB2. So those are the proteins that's on the surface of nerve cells and on the surface of immune cells. So what can stimulate those receptors? So cannabinoids can, and where do they come from? There's 3 main sources. There's the endocannabinoids that's in our bodies. There's the phytocannabinoids, which is what you get from a dispensary when you have a qualified condition, or if you're taking a CBD or hemp-based product. And then there's synthetic cannabinoids. One example of that is Marinol. Marinol is this pure Delta-9 THC that was FDA approved in 1985 for chemo-related nausea and weight loss. However, when we look at where patients seem to gain the most benefit, It's in the first two, from the endocannabinoids in your body and also the phytocannabinoids. And that's because there's multiple cannabinoids in the plant-based medicine that are working on the same receptors. And that's not it. We're not even talking about the terpenes. We're talking about just the phytocannabinoids. And when we can stimulate those receptors in different ways, different binding affinities, different strengths. So having your precursors to CBD, the precursor to THC, the acidic forms of both, and then the heated forms of both, there you get a big complement, essentially an entourage effect with the various phytocannabinoids that you don't see with synthetic cannabinoids.
Yeah. And synthetic cannabinoids are typically only THC. So you don't have any CBD in there. So it doesn't help you, or it doesn't mask, or it doesn't help you control a lot of the negative side effects of THC. Is that correct?
That's correct. And when you look at our endocannabinoid system, it not only regulates things like pain and anxiety, but it also regulates appetite. It helps with us feeling happy. So that's what we call the runner's high, is one example where you see that. It helps regulate the immune system, mood, and memory. So there's so many different applications of that system, the endocannabinoid system. And this is why cannabis helps with so many different conditions that are completely unrelated.
Yeah. Now, there's a perception that the endocannabinoids and phytocannabinoids working together, that they work directly with the CB1 and CB2 receptors. But in reality, when you take cannabis, it goes into your fatty acids. And again, we went back to your Houston, we have a problem, your brain, your nervous system. When you say we have a problem, what's interesting is those fatty acids get turned into long chain fatty acids. And then those are then distributed through your bloodstream to the part of your body as endocannabinoids to be able to address that particular condition. Now, this is a fairly common thing. This is a fairly common way cannabis works. Is that correct?
Yep. And so also when we see the next slide, it'll show even more. And so these endocannabinoids and phytocannabinoids, they come from fatty acids. This is what our body makes when we're creating R-anandamide and R2-acylglycerol. That's actually the name of our endocannabinoids, by the way. That's our body's THC and our body's CBD, anandamide and 2-acylglycerol. And so when it's broken down into fatty acids and glycerol. And the same with the phytocannabinoids. When they're broken down to fatty acids. So what builds them up? They're created, and then they're broken down. They break down back into fatty acids, which is their building blocks. Mm-hmm. And when we look at THC and CBD, the story goes beyond the endocannabinoid system. So if you look at that chart there, the CBD, and that list there, what that is different proteins on the surface of nerve cells. So these are other receptors outside of just the CB1 and CB2 receptors. And these receptors are also responsible for things like pain, inflammation, coronary circulation, body temperature, digestive processes. And so this is where with CBD, you can not only interact with the endocannabinoid system, you're interacting with other receptors outside of the endocannabinoid system. So now we're looking at A2A, which is an adenosine receptor, the GRP55 receptor, the VR receptor, which is the vanilloid receptor, that's associated with transmission of pain. And then 5-HT, which is the serotonin receptor, that's associated with digestion, blood flow, breathing, also with mood and anxiety. And so if we can bring our body's CBD, bring CBD into our body to interact with those different receptors, we can get more benefit other than just the endocannabinoid system.
It's almost like I would say, I'm going to use a very loose term. It's almost like a super vitamin for our bodies.
There's some people that believe everybody should be on CBD. We should just be taking different amounts of it. There are some physicians that feel that way. And so why can't we measure this? The reason we can't measure your endocannabinoids is because they're made on demand. So there's not like a consistent blood supply. However, as technology advances, there may be at some point where we can do a genetic test to see, okay, do you have a high expression of your endocannabinoids or a low expression of your endocannabinoids? And then we can start to give an estimate. Okay, this is about how much CBD or THC you might need. You might be in the low range, you might be in a medium range, or you might need a large amount. But for right now, we don't have that technology. So what we do is we have the patient start the cannabis, and basically go by your symptoms. So when you start to feel better, we know that, okay, you're at that therapeutic dose. If you start to feel side effects, then maybe that's not the best product for you. So you can switch products. You can go up on a CBD or down on
use
a
less of
THC
it.
and adjust it.
Yeah, or use less
Yes.
of it, right?
Yes, absolutely.
Right. Both of those. So let's talk about how cannabis has evolved in medicine. I know when I've got involved with, when I was a kid, I heard about indica and sativa, but lately, the last 10 years, they talked about strains, but all of a sudden, last year and a half, they've been talking about cultivars. Terel, what's a cultivar and why do we call them this?
So cultivar, sometimes referred to as chemovars, is chemical varieties. So chemo, think of chemical, the vars variety. So there's different types of cannabis. So we have indicas, sativas, and hybrids. So when you hear about OG Kush, when you hear about Granddaddy Purple, when you hear Girl Scout cookies, when you hear these different names, they're talking about different chemovars, different chemical varieties that have different concentrations of THC and CBD. One of the reasons why a lot of the medicines, the chemovars, tend to be higher in THC is because they're more potent. So if you're going to purchase a product and spend your money, would you rather have 12% of medicine or 20% of medicine? Would you rather have 15% of medicine of your medicine or 25%? So there's a trend toward higher THC for this reason, that it tends to be a little bit more potent. So you need less of it. It lasts you longer.
Right. Right. And that's counter to the adult use or recreational use, where you don't necessarily want to take more, because when you take more, it actually counters what you're trying to do. You're trying to find your therapeutic dose and being able to address the relief, get the relief from that particular condition that you're trying to address at that point in time. There's a good point. I think you call that the sweet spot, your therapeutic dose, right?
So with the sweet spot, this is basically where you're getting alleviation of most of your symptoms without the side effects. And you can reach that because the cannabinoids, the terpenes have different profiles. You can start with one medicine, and if it's not helping you reach your goals, you can switch to a different chemovar. And that's the wonderful thing about cannabis, is that there's thousands of chemovars, literally thousands.
Right. And a chemovar, I tend to look at them as, I look at the cultivars or chemovars as what they call the chemical fingerprint. What is it designed to really do? And I think this also has to do with this slide here. That you talk about your sweet spot. We were talking earlier, and I know we went over it before, but I think dosing is so important. One of the keys that people need to understand is to find your sweet spot. You really need to go low and go slow, and then to find that optimal dose. So walk us through this, Terel, because this is very important. I know a lot of people don't really understand dosing, but when you put it in this context, you really understand that there is a certain amount of product you can take that will help you. And candidly, after that, you're wasting your money. So you can save your money by not using too much of it, right?
So in that graph there, what it's looking at is how do you reach that optimal dose? So as you increase the amount that you take, you'll start to get to a point where you've left low benefit and you're starting to reach high benefit. And then when you get to that point of high benefit, that's the range that you want to stay in. But if you keep taking the medicine, then that benefit starts to decline. One example is with nausea. So if you're taking the medicine for nausea, you may get to a point where there's a lot of benefit, but then you get too high of a dose, you basically go off of the cliff, and now you start to get nauseous, right? So whatever you're treating starts to cause that problem. So you go from low benefit to high benefit, and you want to stay in that high benefit. So don't continue to increase the dose, because now you're going to start to get side effects and not any additional benefit.
Right. Now, what's interesting is people ask the question, well, what should I be taking? Your body will tell you. Your body is what you really need to listen to when you're going through this whole process of finding your optimal dosing level. I can tell you myself, because I have herniated discs in my neck, when I started taking more and more of the product, I went going low and going slow. I got to a point where it really was, my pain level was down below a 1 when it was coming from an 8 or a 9. Once I started taking too much of it, the pain levels started coming back. And I could tell my body was telling me, stop. You were where you wanted to be. You don't need more. So really listening to your body is really critical, right?
This is really the key to finding success with the medicine. And, the thing to keep in mind is that you can make these adjustments. And in some cases, if you have a particular type of cannabis that you like and you're doing well with it, but let's say you're getting pain relief, but you're feeling a little bit dizzy too, one technique to shift this curve is to take your CBD first. So you can take your CBD drops, you can take the CBD orally, take that 30 minutes to an hour before your THC, then you can still get the benefit of the THC pain relief without the side effects of the THC.
Mm-hmm. That's really,
You
really
can actually shift the curve. That's what I think is amazing about the medicine. You know, we can't really do that with other medications, but with this, you can shift the curve to get less side effects and more benefit.
Yeah, dosing is one of the most important things about your whole medical cannabis experience. And I should point out, at the end of March, I'm doing a webinar just on dosing itself. That's how important it is. And I think it's one of the most important webinars we do during the whole series. I know there's a lot of important ones, but that is overriding. It helps every particular condition that's out there. And candidly, if you get that right, you feel a lot better. That's what it's all about. Now, we talked about terpenes earlier. I want to point out, people ask me, what are terpenes? Well, terpenes are, in nature, they are there to really defend the plant. They're part of the plant. They help range from stopping fungi, insects, pests, large grazing animals from eating the plant. But they're also found in essential oils. So they're found in not just cannabis, but also other plants as well. And so those terpenes then turn out to have therapeutic medicinal values. Terel, tell me about a few of your favorites or what you find very interesting. These are the ones that really help a lot with cancer. Is that correct?
Yeah, so let's take a look at these terpenes going from left to right. So, you know, limonene is found in citrus fruits, and there's a lot of potential benefits of it. It can help elevate mood. It can actually stabilize mood as well, reduce stress. It can help with nausea too. Alpha pinene is found in pine trees. That's a strong anti-inflammatory. So this is one thing where patients that need a reduction in that inflammation, like rheumatoid arthritis patients with lupus, patients with cancer-related swelling, inflammation. This is one of those medicines that would help in a topical form or can be taken orally as well. Linalool is an amazing terpene. So there's over 30 species of lavender plants, and linalool has a relaxing effect. It's also a local anesthetic. So if you can find it in a topical form, it's very good for neuropathy. Neuropathy is a pins and needle sensation of the hands and feet. It's often seen with chemotherapy, and a lot of patients, when they're undergoing their chemo or radiation, they can develop pain from nerve damage, and this is one thing that can help in a topical formulation.
Yeah, we should point out that next
common terpenes.
Terel, we should point out next Wednesday, you and I will be giving a webinar on neuropathy, right?
Yes, and we'll definitely get into more detail about the mechanisms here for neuropathy. That there's a lot of causes of it, from diabetes to cancer itself, to cancer treatment, to medication side effects, to hereditary causes. But we'll get in a little bit more detail on the mechanisms of how the different treatments help for neuropathy on that presentation.
Linalool is a very good terpene. Tell me about myrcene.
It's actually one of the most common terpenes that's found in cannabis, and it's in the majority of chemovars that you might see available for commercial use. It's one that is very good for relaxation, and there's a combination of taking mangoes and smoking cannabis that some people do to make the cannabis work stronger. So that's an entourage effect that you get when you eat mangoes and consume cannabis. With beta-caryophyllene, that is a terpene that acts very similar to cannabinoids. So this works on CB2 receptors, very similar to CBD, and it's an anti-inflammatory. It's found in fresh cracked pepper. Eucalyptol, which is also found in eucalyptus trees, is very good as a local anesthetic, a soothing agent for the skin and for injuries.
Right. And these are some of the most common terpenes, and they're found in most products. When you go into a dispensary, you can actually talk to the person behind the counter and request and find out information about what your product, what terpenes are in the product that you're looking at purchasing. Is that correct?
So with each product, there is a list of terpenes and their concentrations, and that can be found on the certificate of lab analysis. The products have a QR code, so you can take your QR scanner, scan that product, and see exactly what's in there and in what concentrations.
Sure. Now, this is a fascinating slide because we didn't talk much about flavonoids, but really the cannabis plant contains cannabinoids, terpenes, and flavonoids. Terrell, tell me about that, because flavonoids are just as important as the cannabinoids and the terpenes, right?
So flavonoids, like terpenes, are found in different foods and different things that we consume, and they're also found in cannabis. When you hear about eat an apple a day keeps the doctor away, they're talking about flavonoids. When you hear about have a glass of wine, that has resveratrol, which protects blood vessels. So those are, the health benefits. As a physician, I can't recommend anyone to drink alcohol, but I'm just explaining what someone is talking about when they say consuming wine is beneficial. That's because it comes from grapes. So there's a lot of health benefits to flavonoids. They're present in lower concentrations for the most part than terpenes and cannabinoids. However, there are some potent health benefits for them as well.
Mm-hmm. But working together, this is where that entourage effect comes into place. We're trying to point out it isn't just one part of the cannabis plant. It's the cannabinoids, terpenes, flavonoids, all working together. I think we showed that chart where 1 and 1 was literally more than 2. That's the magic of cannabis. It's there.
And that's just so you have a molecule, it has a good efficacy, it works at the receptor. However, when you add other components, it helps it work even better. So that's the entourage effect. And that happens with cannabinoids, it happens with terpenes, it happens with flavonoids as well.
Right. And so let's talk about, we've talked about cancer, cannabis. Let's talk about the research that's been done that's out there. PubMed, which is really important, is something that most doctors, in fact, you as a private individual now can go access. Is that right, Terrell?
So, when you search different online tools, one is PubMed, which is the National Institute of Health. You can find that there's a lot of studies now on marijuana. And actually, this is the most commonly searched term. If you search marijuana, you search cannabinoids, you search cannabis, you search medical cannabis, marijuana in general will have more studies that will come up. So you can actually see what studies have been done. And there's 2 major categories. One is preclinical. So preclinical is basically non-human studies. So those could be studies of animals, those could be studies on human cells. And then there's clinical studies. So clinical studies for cancer are usually observational. There are some small studies, like I mentioned earlier about the study on limonene for breast cancer patients, but those do tend to be small. If you ever get to a point where you want to see how many studies are done on a particular cancer, you can go to this resource. You can search breast cancer and marijuana. Those studies will come up. You can search liver cancer or colon cancer and marijuana, and it'll come up on this resource. So, when you look at cancer, we have to think about what's the subtype, how aggressive it is. This is where you would go to find that specific detail on that cancer type that the person that you're researching this for is dealing with. Or if there's a patient listening in, this is what you would take to your doctor. So you would go here, search your type of cancer, search marijuana, and bring those results to your doctor to discuss it with them.
It's fascinating that most of the research that's in the PubMed, the National Institute of Health database, is especially on marijuana, has been done outside the United States. This is not a resource just for the U.S. It's a resource for the world. It's been out there. And there's also the National Cancer Institute that's got some studies that are out here, as well as the that we found that have different studies that we can research. So let's dive into some of those. Terrell, tell me a little bit about, this is kind of a quick overview of all the studies that were out there. This is kind of a quick synopsis of what they all summarize, right? The cancer symptoms, you look at how patients cope with it. Why don't you tell me a little bit about this?
So, when we think about cancer, there's actually lots of types of cancer. So, there's any tissue type, any organ type can develop cancer. So there's a variety of different symptoms and presentations that can happen. So some of the main symptoms are pain, nausea, weight loss. When you think about, the physical injury, that pain, that's one type of pain. But then there's also the emotional part. And so just the patient's ability to cope with battling a cancer illness, that can also, be something that can be devastating to the patient as well. There are studies that have shown that medical marijuana can help actually shrink the tumor. So we're not just talking about treating the symptoms, we're also, or just helping the patient cope, we're talking about treating the tumors, treating the cancer itself. So those are the different types of resources or different types of research that has been looked at.
Yeah. And here's the actual research that you found here. Is that right?
And so, yeah, so when we consider, where are we trying to impact and give a positive healing result for the patient, these are just different considerations. So cannabinoid signaling in pain, so we're blocking the pain at multiple areas. If it's an analgesic, meaning if it's providing pain relief, is it opioid sparing? So is it helping the patient to need less doses of morphine, less doses of fentanyl, less doses of different medicines that can be more addictive and can cause constipation, nausea, and things like that? And how much benefit does the patient get? What's the efficacy of cannabinoids in cancer-related pain? For quality control, administration, and dosing, those are things that are for the individual patient, because everyone is going to be dosed differently based on their goals. Are they trying to treat nausea? Are they trying to treat pain? Are they trying to cope with the diagnosis of cancer? Or are they trying to help shrink the tumor itself? Are they trying to make the chemotherapy and radiation work better?
Mm-hmm.
You have chemo-induced nausea and vomiting, which is a very common symptom for many patients. And you also want to think about well-being. What is the level of peace that the patient has when they're dealing with this? Cannabis is really one of the only medicines that can help a patient cope and have a greater sense of well-being during their treatments.
Yeah, I think,
There's
obviously
paradoxical
when
and
you have
dose.
cancer, your stress and anxiety level goes up substantially, right?
So anxiety on not just the cancer, about the treatment, what is the regimen that the physician is going to prescribe? Am I going to have to get IVs? Am I going to have to come into the hospital? Am I going to have to get radiation? And then what are the side effects? So there's so many different sources of anxiety for patients. And what we talked about earlier about starting low and going slow, as you start THC, you don't want to get up to a point where it's causing anxiety, right? So we want to, with anything, we want to start low and slowly increase that dose as we're, trying to impact that anxiety, but then keeping in mind that we can add the CBD that will prevent some of those side effects and also help the THC work better. Mm-hmm. So we want to think about the impact of cannabis on sleep disturbance, because that is another area where we can get a lot of benefit by helping patients sleep through the night. How cannabis affects PTSD and mood, the potential role for the minor cannabinoids, so that's like your CBG, your CBN, and then looking at terpenes alone. That could be a botanical therapy. For example, aromatherapy with linalool, that could be a treatment by itself as an isolated treatment. And then we want to think about using cannabis in a clinical setting. And for oncology patients, education is important. And that education may not always be given by your oncologist. You may have to go to a specific specialist, a cannabis recommending physician that's more knowledgeable and specializes in those recommendations to get that type of information.
Yeah. But there are resources out there, and there have been studies to indicate in this particular study on the treatment of side effects related to cannabis and related to how cannabis and cannabinoids address cancer. This is very important. I think this is critical. This isn't something that just we came up with. It's something that's been researched and studied. Now, Rick Simpson he's an interesting guy. Terel, tell me a little bit about him, because he's still around, and he's still how should I say, making a contribution to treating cancer.
So Rick Simpson was a farmer in Canada, and he grew cannabis for patients before it was legal there. And so he used the cannabis oil to not only treat himself, but to treat other patients in their cancers. He used it for, I believe it was a basal cell carcinoma, to put that into remission. And when he grew the cannabis, he found that patients needed a higher dose to get benefit in their cancers. And so one way he helped them obtain that higher dose is he extracted the medicine from the plant. And so he used ethanol to do that. Ethanol is used to actually do food extracts as well. So when he did that extract, he would take about a gram of cannabis flower, extract it, so now it's concentrated, and then the patients would take that cannabis. So that's what you see in that picture is the Rick Simpson oil, often referred to as RSO. And that's one of the ways that patients with cancer consume cannabis is through RSO, which is a concentrated cannabinoid extract.
Right. Now, what's interesting about what he did was much like the people, the gentleman who had founded insulin donated that to the world. They never charged anybody for it. They never charged royalties for it. That's why I have a hard time with pharma companies that are charging so much money for something that was handed to them. He did the same thing. He came up with the process of RSO, how to create it, how to create a whole plant medicine, but he basically contributed that to the world. That's why you find a number of folks that are out there, a number of dispensaries that are providing RSO products. RSO is the process of creating a whole plant concentrated oil. And I find it this is very, very interesting. This is a guy who's really helped thousands of people address their particular situation, not just cancer, but anything that has to do with needing cannabis to address, from a whole plant standpoint, the medical condition that you're suffering from. Now, the other one I mentioned earlier was Dr. Cristina Sanchez. She was a student of Rafael Mechoulam's in Spain. And in 2002, let me go back and say that again, 2002, Spain came to her and said, we will build you a lab to research cannabis and cancer. And she's been doing that ever since. And she's been putting a number of she's not only speaking, but she has a number of studies in PubMed on cancer and cannabis, especially breast cancer. You've heard of her, right? Right, Terel? Followed some of her work.
Yeah. So, what will actually, it might have been in one of the earlier slides. Is what cannabis does is one way it can work is induce apoptosis. So she's studying, how cannabis is killing cancer cells. So she is studying these mechanisms, and what's amazing about this is that once we understand the mechanisms, then we can look at and get a variety of cannabinoids, a variety of terpenes that work by different mechanisms, and get essentially an entourage effect of putting a cancer into remission. That's really the ultimate goal. The ultimate goal is to, not just treat the symptoms of cancer, but actually treat the cancer itself. So she's doing preclinical studies. So she's studying cells, and she's human cells, and using animal models to see how can we intervene on the various forms of cancer growth and the various types of cancer. So eventually, hopefully, as this research is shared with other oncologists and clinical specialists, we'll know better how to apply different cannabinoids to different types of cancer subtypes.
Right. And she feels right now that there's enough preclinical evidence to support that cannabis has anti-tumoral properties. That's a very important breakthrough. And as you mentioned, sharing it with other researchers and sharing it to the world is really, really important. We here in the United States really need to change our thinking about research and really start diving into it and embracing these ideas, because there's something that can help us quite a bit in just being able to treat patients and be able to bring comfort and relief to a lot of families. This is another this was an anti-cancer agent. Why don't you walk me through that? This is where they did some preclinical articles. They studied preclinical articles, right?
So let's see, looking here, these are basically different types of research studies that have been completed. And these are different search results that might come up if you're looking to see what's already been published. So one result was over 200 preclinical articles that were reviewed, and over 100 of those, were original data. So they weren't just repeating, other research studies. So that's one set of results that came up. Over 70 were unique case reports. So these were patients with breast cancer, brain tumors, gynecologic cancers, leukemia, that were using cannabis. Another set of data showed that 14% of the case reports were considered strong evidence. 5% were moderate. The remaining 81% were weak studies. And so what that is telling us with weak studies is that we need to develop stronger studies. We need to develop more organizations that are funding these types of studies so that they can be strong and we can find evidence. So the patients that are getting benefit, why are they getting benefit? And the ones that aren't, what could be done differently? 10% of cases were.
Go ahead.
So 10% were in pediatric patients, and a lot of those were likely glioblastomas and medulloblastomas, brain tumors. And in those studies, CBD use was most often reported as the anti-cancer cannabinoid, with daily doses ranging from 10 to 800 milligrams. So it's a wide range. And in THC, doses range from 4.8 to 5.7 milligrams.
Yeah.
But I've seen patients need, 60 milligrams, 100 milligrams a day. And if you look at the RSO, that's going to be much more concentrated than just, 5 to 10 milligrams, right? So in that case, you're going to be 50, 100, 200 milligrams per dose.
Right. And what's fascinating is when I went through a lot of these studies, I was kind of figuring out, why are they coming up with weak studies? A lot of the studies were smoking cannabis. There was this whole thing about the only way you could use cannabis was to smoke it. And really up until about 5 years ago, that was considered the preferred way of studying cannabis. And what's interesting is when you light a joint, you're burning off 50% of the cannabinoids, all the terpenes and all the flavonoids. You weren't getting the complete medicinal value of cannabis. When they started doing cannabis studies using tinctures, using topicals, using capsules, what they found out is the efficacy, where you start moving over to those strong studies, it started showing how much more effective it is being able to use not necessarily smoking a joint. Using concentrates, for example, is a lot more effective than just smoking a joint by itself. So I think the method had a lot to do with how the studies were done and the results that came out of that. And hopefully we're learning a lot more about that and doing better studies now. It's there.
Yeah, that's a good point. Yeah, most of these patients were not using a concentrated cannabis. They weren't using a Rex or like a Rick Simpson oil or anything like that. But hopefully we'll continue to get at least more case reports, at least more small publications of those patients that are getting benefit. So that way we can combine those, and hopefully we'll have patients that can follow those patterns of success and repeat them.
Sure. Now, here's an example of, now this is from a group called Cure Your Own Cancer. I'm just bringing this up. This is Kelly, who started in the year 2000. They discovered that she had cancer. She started using RSO. And in 2014, she really started going at it with not just using RSO, but also supplementing that with things like yoga, using juices and things like that. And she's now in remission. When you see the word cured, it's important to point out, I think we need to point out, Terel, you're not going to stop creating cancerous cells in your body. Your body does that naturally. What you really do is you put those cancerous cells in remission, where you can control them and they're not going to destroy your body. Is that correct?
Yes. Yeah, we're very careful with using that term cure because, can something come back? Potentially, yes. So like you even look at something like a disc herniation. You have a disc herniation, you have surgery, it's repaired, it's gone. Can the disc herniation come back? Yes, it can potentially come back. So she's probably on a maintenance treatment as well. And I like that she's combining different treatments. There's more than one way to heal the body. So she's using meditation, yoga, organic juicing. So she's getting terpenes, she's getting flavonoids as well. She's using natural healing techniques. So it's not just the cannabis alone in isolation. You're combining this into a full, complete lifestyle.
Right. I think also Patricia is the same kind of thing, where she was, again, and you notice there's a clear pattern here. These folks are using RSO type products to be able to address their particular situations. And this is from a website called For the Life of Me film. They actually film a lot of these folks, and they follow their process of being able to address cancer with cannabis. There's some important websites that are out there. So she in fact, the problem with a lot of these patients is that before they get into cannabis, they go through very high concentrations of radiation and chemotherapy, which damages the body. And really, cancer can't reverse that damage. Is that right, Terel?
It's one of those things where the treatment can be as devastating as the disease in a lot of cases. You have, radiation related damage to different tissues, chemo related damage to different tissues. And in some cases patients are using the cannabis to actually help them tolerate treatment, to tolerate chemo, to tolerate radiation. But hopefully, as we have more stories like Patricia's story, and other patients will see, okay, what is the best dose range?
Right.
I have a feeling, just like anything else, it's going to be dose dependent, but the dosage for nausea that's going to be different from pain. That's going to be different for cancer. And so, we should just collect, these studies and kind of put them all together and just kind of keep them in mind for patients that's dealing with cancer.
Yeah, we need more research. There's no question about it. I mean, to summarize this, what we did was we found out that there's no studies done in the United States because it's a Schedule I drug. But here's Spain, Israel, and the UK doing studies. And what we found out is that medical marijuana, is something that can be addressed by cancer. And here in Florida, your medical marijuana, one of the qualifying conditions is in fact cancer, as well as it can help with chemotherapy. Most dispensaries carry RSO oil. Rick Simpson himself, through Phoenix Tears, has thousands of testimonies on this. And of course, Christina Sanchez has come up with a lot of studies to show that there's evidence that we need to do more studies. It can in fact be a potential path to be able to help with that. As a summary, Terel, what's your thoughts of the research?
We need more. That's really what my thoughts are. We need more. We're coming closer. CBD, was rescheduled. We have a medicine on the market called Epidiolex, but it's only for seizures. It's not FDA indicated for cancer, but, hopefully we'll reschedule THC so then we can do more research on the whole plant to see, where can patients gain the most benefit? What's the best concentration of CBD and THC that's needed?
Right. And as we mentioned earlier, there's a number of different ways of taking cannabis itself. I know that we talked about sublingual drops, which is the ones here in the middle. That's how a lot of people start, put some drops underneath their tongue. And that typically takes about 15 to 30 minutes to work and lasts for 4 to 6 hours. But it's a very effective way of taking cannabis, and a lot of ways people start. I know that's how I started, and I know that's how I recommend people start. It's really a very effective way of handling cannabis. And again, there's an onset time. When I start taking it, how long does it, before I feel it where it starts working, then how long does it work? I point that out because in a case like my case, I have herniated discs in my neck. They do not go away during the day. If I take cannabis in the morning, in the late afternoon and in the evenings, the pain comes back because it's worn off. So I need to do something in the morning. I need to have a regime that does something in the middle of the afternoon, and I need to do something in the evening to be able to really keep my pain level below a 1, which is what I want to do. I think sublingual drops are very effective. There's also, you talked about concentrates. Tell me a little bit about inhalation. I know people hear about smoking a joint, but really the concentrates and inhalers are very effective, aren't they, Terel?
So these are often 3 times more concentrated than what the plant grows. And with the higher concentration, you need less medicine. Mm-hmm. These are something that will give you more immediate relief, where you don't have to wait as long as you would for oral, which can sometimes be 2 hours. Right. Sublingual could be 20 minutes or more. With inhalation, you get results pretty quickly within 2 to 5 minutes. Mm-hmm. Topical is much more variable. Sometimes it actually may take a day or 2, just depends on the situation, how much inflammation. But for a lot of patients, dealing with rheumatoid arthritis, you can often see improvement with topicals within 24 hours, just after 1 or 2 doses.
Actually, sometimes even immediately. I know I've been getting some arthritis in my fingers, and when I put on the transdermal cream, literally within 5 minutes, the pain is going away. So it depends on the person and the particular condition too that's out there. One of the fun parts is what they call orals, the capsules and the edibles. They take a while to work, somewhere between 30 minutes to 2 hours. There's the famous saying that about the time that you don't think it's working and you take more is about the time it usually kicks in. Tell me about that, because it's being it's being processed by your stomach, which takes a while to be able to have that take effect. Is that correct? Terel?
When you take Delta-9 THC orally, it goes through your liver. It gets converted to a more potent form of cannabis. It gets converted to 11-hydroxy THC, and that's more potent. So it becomes much stronger and it's much more difficult to control. Whereas with sublingual, with inhalation, we say that you can titrate those, meaning you can adjust those much more easily. Um, if you start with an oral dose and you don't see any benefit within 10 to 15 minutes and take another one, and just wait 10 or 15 minutes and take another one, at that point you may have overdosed. Not saying you'll stop your breathing or anything like that, but you've taken too much. You might, feel too high or feel too dizzy or too relaxed. So with oral, you have to be much more patient because it can take 1.5, it can take 2 hours for that first dose to start working and kick in.
Sure, it's there. So let's talk a little bit about the bottom line. I mean, we've gone through a lot of slides, and I want to jump into the questions really quickly. But the bottom line that we want people to walk away understanding is that you're in control. You control what you take, how much CBD, how much THC. You control when you find your therapeutic level. That's what's really important. And I think the other part of it is, Terel, people don't get addicted. You're not going to get addicted from cannabis, right?
Yep. It's not like opioids. It's not like other medicines that's, with a high potential for addiction that you'll get sick when you stop it. There's not a withdrawal syndrome like you see with opioids. If you're taking them for a few months, you can't just stop cold turkey. You'll get sick and have withdrawal. You don't see that with cannabis. It's much more forgiving, much more forgiving. Yep.
And you're not going to overdose. You're not going to die from using it. And the entourage effect comes into play. Now, I do want to mention, you mentioned resources. I do want to mention there's one resource you may want to take advantage of. It's called IGotMyLifeBack.com. This is where if you have a medical cannabis story, please tell us what it is. We'd like to know more about it. And also the world would like to understand more about it. And if you're looking for studies of cannabis, this is a good site to be able to look at. I also want to point out, if you're looking for a CBD product, we do have a store called My Botanical Wellness. It's a pure CBD product, so it can help you quite a bit. And then shamelessly, we're going to promote our webinars that's coming up in the future. Next week, you and I are doing neuropathy. Then we're going to talk about anxiety, stress, sleep, terpenes, and dosing. So that's some of the things that are coming up. But I think we covered most of the questions. Speaking of that, let's jump into some questions. Let's start by the questions that were asked during this particular session. Terel, one question we have is, cancer is possible to go away paired with both cannabis and chemotherapy. Why don't you take that one on, Terel? Because I think what you're talking about here is putting it in remission, not necessarily having it go away, right?
The research studies have shown that there's a synergistic benefit. So where you have a chemotherapy agent exposed, so you're trying to kill the cells with chemotherapy. At a certain concentration, that will happen. However, it can happen even faster in the presence of cannabis. So that's what some research studies have shown, that the cells die and they don't need as much chemotherapy, or they'll die faster when exposed to chemotherapy. So that's what the studies have shown. And so these are cancer cells that's being studied, and it's shown that the cannabis, in particular, the one I'm thinking of right now was a CBD study. So there's a synergistic benefit, meaning that the CBD is making the chemotherapy work even better.
Sure. I know there was another question that came up that said, what percentage of THC and CBD work best? We really can't answer that question. This has to do with your body. It goes back to the dosing issue. You've got to really dose to find out what's going to help you and what's not going to help you. I don't think we can have an effective answer to that question.
You just have to go by clinical observation with that. You have to look at, if you're talking about the cancer itself, a lot of those studies they were taking hundreds of milligrams, right? So 100, one range was up to 800 milligrams of CBD. And you're not going to have the side effects like you would with the THC, So, the CBD, it stops the ID1 gene. So that's one mechanism. THC induces something called ceramide. So ceramide is a protein in the mitochondria, which is the powerhouse of the shell of a cell. So it's basically shutting off the energy supply of the cell. They're working by different mechanisms. So you would imagine that if both are present, then they would work much better than just taking just one of them.
Yeah.
But we can't give you a specific dose. All we can say is, okay, this is what was observed. These patients got benefit, and this is the dose that they took. But there's so many different types of cancer.
Too.
Yeah.
Your body accepts it. Found out what you're dosing.
Yes. Yeah, there's so many different types of cancer, like even one tissue, even within breast cancer, there's so many different subtypes of breast cancer, some less aggressive, some more aggressive. So until we have larger studies, I'm talking about with hundreds of people, thousands of people, then we can, until then, we can't tell you exactly what dose is going to work best.
Right. And that goes, I know there's a question that came up, says, how do I choose, I think, which chemo that I need? I think that's a question for you, Terel.
What was the question?
How do I choose which chemo that I need?
Oh, your oncologist will choose that. You don't have to choose what chemo you need. Your oncologist chooses that. What they prescribe to you. And just take your list of questions. You know, how likely is this to help? Is there any adverse side effects? How often do the adverse side effects occur? And that's a decision that your oncologist will make.
Now, one of the other questions that came up is, says I have asthma, can I use the inhaled cannabis?
So that depends. That depends. In general, you can get actually a side benefit in asthma because cannabis is an anti-inflammatory. If your asthma is really, really bad, you may not want to inhale anything outside of just your medicine. So, consider alternative routes. So, look at the oral route, look at the topical. If you're dealing with pain, look at the sublingual route. So consider other routes. But ultimately, discuss that with your physician. But that's the wonderful thing about the medicine. It's very versatile that you don't necessarily have to take it in through your lungs.
Yeah, you're not stuck with one route of administration. You can try a number of different ways. You try edibles, for example. You try capsules, that type of thing, to really help you. With that. One question that just came in, it says, after initial medical evaluation, how often will I be reevaluated by the doctor?
What's what diagnosis?
No, it says after initial medical evaluation, how often will I be reevaluated by the doctor? I think legally,
for what diagnosis?
Every 6 months you have to see the doctor, right?
Well, I wouldn't say that. I wouldn't say that because when you're dealing with cancer, you don't know. Right. Is it stage 4? You may, if it's an aggressive cancer, you may want to follow up sooner. Right. As far as like when your order gets put in, the recommendation, the orders can be put in for 7 months, but that's a long time to go without knowing how a patient is doing. Sure. If they're in hospice, I would want to follow them more closely. I would want to be more aggressive. They're dealing with end of life issues, end of life care. I would want to make sure that patient is as comfortable as soon as possible. So, then you might want to follow up more frequently, but it's going to be based on your medical condition.
Right. That's very important. And the doctor has to make the consideration as to the follow-up process. Now, in the pre-submitted questions, one of the questions that came up, it says, does marijuana interfere with traditional treatment like chemo? What are cancer doctors' thoughts using marijuana? I think what it really does is it really helps, let's just say, bring out the best of chemo is the best way of putting it. It really works with chemo. Is that right?
Well, that's why we're saying, get this information, bring this to your doctor, discuss it with them, and see how it can complement your current treatment. So we're not saying to replace your treatment with this. We're just saying, let's see how it can add to your treatment, how it can help you get better results.
Right. I think we have one that says, I can't smoke or inhale medication due to asthma. What oral routes are available? There are a number of oral routes. You have pills, right? You have
capsules, you have lozenges, basically, like you mentioned earlier, Mark, the different edible medications. You can take drops under the tongue or orally. So it could be used either route. You can even take them both. You could take them sublingual and then swallow it.
Sure. The next question was, I have stage 4 lung cancer, new to the whole medical marijuana card. Does medical marijuana work for cancer patients in Florida? Terel, I'll let you answer that one.
So the diagnosis of stage determines your prognosis. So that's something that has to be discussed with your diagnosing physician, is what is your prognosis. However, as far as getting benefit, then you have to decide what is your goals with the cannabis. Are you taking it to help facilitate treatment, to help you tolerate treatment? Are you taking it to feel comfortable? Are you taking it to try to help the chemo and radiation work better. So that's going to be really individual discussion with your physician. That's not something that we can answer or know, because we would have to know exactly what type of cancer it is.
Yeah, and I've seen cancer patients here in Florida be helped using medical cannabis. Again, it's a process of the doctor working with you, and it is.
Yeah,
an
you have to decide what your goals are. Right. You know, what are you? Yeah, and so then once you know what the goals are, then that can help you. You would go that type of question you would take to your recommending physician, your recommending cannabis physician. Your oncologist may not know enough about medical cannabis to give you those details of, you know, what's the best thing for nausea or what's the best thing for pain.
Mm-hmm. Right. One of the other questions is it true that there are healing properties that can prevent cancers? I think taking, you mentioned CBD, excuse me, taking a regimen of CBD is going to really help you potentially prevent cancers. Is that correct?
Well, your body and your own health is going to be the number one thing. So there was an earlier slide that showed how your body naturally fights off cancers, and that process is taking place all the time. So whatever you can do to maximize your own immune system, that's going to be the number one thing. But cannabis, there's no clinical studies that show that cannabis is going to help your body do that better than you can on your own. However, theoretically, it would likely give you some benefits. It would likely have some protective aspects, but the research on that has not been yet done. Right. But what you can do is avoid things that cause cancer. So, you know, avoid a lot of what we call carcinogens. So having a large amount of smoked meats is one way to cause cancer. So you would want to do the opposite of that. You would want to avoid that. Being exposed to radiation, being exposed to harsh environments is something that causes cancer. So you would want to do the opposite of that, avoid that. Being exposed to smoke by smoking or cigarettes or cigar smoke causes cancer. So you want to do the opposite, avoid that. Avoid secondhand smoke and avoid consuming that yourself. Consuming processed meats is something else that causes cancer. So you would want to avoid that. So you want to try to have a diet that's high in antioxidants. So cruciferous vegetables is high in antioxidants. That's kale, broccoli, Brussels sprouts, broccoli sprouts, cauliflower, things like that.
Mm-hmm. That's great. The next question is, what is RSO for cancer patients? I think we addressed that in the slides. I'm not sure we need to talk much more about that. If we do need to talk more about it, whoever asked that question can ping us. Do you have any comments on that, Terel?
Yeah, RSO is Rick Simpson oil. It's a concentrated cannabis from the flower that's an ethanol extraction. And so it was observed that he was able to help some patients go into remission with their cancer by taking a high dose of a concentrate. Mm-hmm. And this specific type of concentrate was formulated through extracting the CBD, THC, other cannabinoids and terpenes through an ethanol extraction. There's other types of extraction. So there's CO2 extraction, there's a butane extraction. But with this particular medicine that he was growing and he was preparing for the patients that he worked with, it was an ethanol extraction.
Right. Next question that came up is, what is the best cannabinoid for sleep? I want to mention that in 2 weeks, we're going to be doing a webinar just on sleep. And I'm really not going to answer it from a cannabinoid standpoint. I'm going to answer it from a terpene standpoint. What we found is that when you use things like linalool, use things like myrcene, have products that have beta-caryophyllene in there, and also limonene, we found is really, really good to help with sleep. Do you have any comments on that term? I think the answer to that is more the terpene profile than the cannabinoids. Is that right?
Yeah, if you combine the right terpenes with cannabinoids like CBN, which is cannabinol, and in some cases THC, you get an indica-like effect. Then you can get good results with 5 to 10 milligrams would be an area that a lot of patients see benefit with CBN and THC when they combine beta-myrcene, linalool, and basically relaxing, sedating terpenes.
Right. Next question that came up is, how can medical marijuana help with asthma, and if so, what type and strain? I'm not sure this seminar was designed to answer that, but do you have any quick comments on that, Terel?
Yes. Asthma is not a qualifying condition, but back in the early 1900s, when physicians could prescribe cannabis, asthma was one of the conditions that we saw improvement, and that's because there's anti-inflammatories. So you have the precursors, the CBD and THC, and CBD and THC themselves are anti-inflammatories. There's alpha-pinene, which is anti-inflammatory, and a lot of the terpenes are also anti-inflammatories. So the same way you can get improvement by having a diet high in anti-inflammatories, cannabis can also help. But cannabis tends to be more concentrated than what we obtain in other foods. So that's the main way that you can get improvement, but it's a side benefit. Asthma is not a qualifying condition, at least not in Florida. But because you're getting so much improvement by reducing inflammation, that is a side benefit that can be observed in a lot of patients.
Right. Couple last questions. One is, please talk about breast cancer and anti-hormonal therapy research with cannabis. I want to mention Dr. Cristina Sanchez. A lot of her work, a lot of her research that she's done was on breast cancer. I would say probably 40% of her research falls in that particular category. Now, I think we can talk, we talked about her, gave it a quick overview. If you really are interested in her, please go to YouTube and please go to PubMed, and you'll find a tremendous amount of research that's out there. I found YouTube, she actually has videos that are her speaking at conferences, as well as research that she's done that'll help quite a bit. So I think I'm going to defer that to have you go to YouTube. You'll be able to ferret that out. Just type in Dr. Cristina Sanchez, and you'll see a lot of research that pops up, and enjoyable to watch. I found it to be very informative. Last question is, what is the best medical marijuana for pain relief? We did a seminar last week on pain relief, and there's a number of different strains. What we'll do is, on this particular question, we'll provide in the follow-up, as we mentioned, we're going to follow up with, send you an email that has a link to this video, has a copy of the presentation. It has links to discounts from dispensaries and all the information we use to put this together. We'll actually provide some information on recommended strains, more importantly, recommended terpenes for pain relief. I don't know, do you want to touch that one for a second, Terel, since it's right, this is in your wheelhouse?
So, you know, this is, I mean, I could really talk about this literally for 7 hours to really answer your question, because there's so many types of pain, you know, without having a diagnosis, it's difficult to be specific. You know, if you're talking about rheumatoid arthritis, you know, high CBD to THC ratios and a topical formulation. If you're talking about back pain from a spinal cord injury, you want to have CBD and THC to alleviate spasms and to interrupt the pain by several different mechanisms. We saw in this presentation how CBD interacts with other receptors, other pain receptors, and you combine that with the THC. In general, the two work best. However, in some cases, you may want to have a higher CBD if you're dealing with more of a mild pain. You may want to have a higher THC if you're dealing with moderate to severe pain. And if you're trying to get enough benefit to wean off of opioids, you may tend to need more THC. Could be anywhere, you know, per dose in a range of 5 milligrams to 15 or 20 milligrams, but each patient is going to be different. Pain is very non-specific, so you really have to see what is the cause of the pain. And you have to remember that pain is also an unpleasant emotional experience, right? So you have to make sure the patient is getting plenty of sleep, combining meditation, and the cannabis is not used alone, but it's used in coordination with other treatments, with physical therapy, with injections, with relaxation, meditation, massage therapy, and things like that.
Sure. Okay, so I'm going to take one last question, and then I think we should wrap this up. The Zoom user asked, how often will I be reevaluated by a medical certified doctor? I'll let you handle that one, Terel. I think it depends on the doctor and the treatment, and this is that doctor-patient relationship. Is that correct?
What was the question?
It says, how often will I be reevaluated by the medical certified doctor?
So recommendations can be up to 7 months, but you may be followed more closely if you're dealing with a more serious condition. You know, it's really going to depend on what the physician recommends. Your card needs to be renewed every year, your medical marijuana card. But you have to call and see what the policy and procedures are of that specific clinic that's doing the recommendations.
Right. It really depends on the doctor that you're working with, but if you have a condition like cancer that needs to be followed up, It's not going to be once every 6 months, which is what the state requires. You're going to probably need more frequent follow-up, and that really depends again on the processes that your particular doctor uses. And I would say I'd address that question with him that's out there. I think they should be. I think you should be getting a number of different follow-ups. That's my opinion. So, Terel, any comments you want to do? Let's wrap this up. I know we've been at this for quite some time. And by the way, I want to thank everybody for hanging in there and listening to the answers and the questions. I know this is an important topic, and hopefully, if we addressed your issue and we addressed your question, hopefully it was something that helped you quite a bit. Our goal is to just help you get your life back. If we help just one person get their life back, we've accomplished what we wanted to in the seminar tonight. But Terel, any closing comments you want to make?
I would say just tune in for the next one, because we'll continue to cover the topic, and cancer can cause neuropathy, so there will be a little bit of overlap, and we'll take a more holistic approach as well. So we'll talk about other treatments, not just the cannabis, but how can other treatments complement the cannabis when you're dealing with pain issues.
Sure. Good. Terel, thank you very much. Your contribution was great. I want to thank everybody who tuned in tonight, because without you, this seminar wouldn't be successful. More importantly, I want to thank a few folks that make this happen. I know Lee has been in the background answering a lot of questions and making things happen. And I want to give a special shout out to Alyssa Katera, who's the one who came up with the idea of this particular webinar series, and also with Leo Wagner, who's helped us put together a lot of material that we use in this particular seminar. So I want to thank everybody for joining us. Next week, we're talking about neuropathy. And as Terel pointed out, this is a good follow-up to this particular situation. You may want to take a look at it. Then we're going into anxiety and stress, sleep management. Then we're going to be talking about terpenes and dosing. So listen, thank you very much for joining us. We look forward to seeing you in the future. And if you have any questions, please let us know. Events at marijuanaaware.com. We'll answer your questions. Thank you very much for joining us tonight. And Terel, thank you very much for your contribution.